Hello everyone, my name is Emmanuel Shafiq and I am from Bayonne, New Jersey, which is right across the Hudson from Manhattan, if anybody's familiar with the area. I'm doing this Master's of Public Health in addition to my Doctor of Podiatric Medicine. I think that a public health degree is it's a good way to know about the holistic medicine, not just how to cure one's issue, rather to see what the public issue is. So my presentation today is on the Bayonne Health Clinic, which is a few blocks from my house. I did some research on it and actually found it very interesting. So I made this presentation and I hope you enjoy it and I hope it's informative. So um, the first thing we're going to look at is the walkthrough of this presentation. So what is public health? What are the levels of public health? What is the mission and population? Focus at the Child Health Clinic in Hudson County, which is the county that I'm in. The demographic served, the levels of prevention that the Bayonne Mental Health Clinic focuses on, essential public health services offered, the contact information if anybody wants to contact them and feels like they're in the area and should somebody need anything, and some references that I used to make this presentation. So what is public health? So public health is divided into three main core functions. Um, Assessment of the situation, public, which is identifying the situation. Public development means how to regulate the situation without having an advance. And assurance, which is how to maintain that people are actually following these regulations and sticking to them. I think I like to use is it was in the book, which is the one about the gates on like the windows, or I read it somewhere. It was like gates on like windows for child health safety, because children were coming to the gates and falling out the windows. So it was a good way to stop the children from exiting the gate, and it was kind of like a good public health safety regulation there. Um, so how does it differ from the public health? As I said earlier, it's more of a holistic view of what the issues are rather than just how to cure the person. It looks at what the issues are with the person, with the population, of why that happened. I think diabetes is a very big one right now, but why we're looking at it from what the issue is going on as diabetes as a population, from what we eat, what we do, to just how to cure it or how to combat it. Okay, so levels of prevention in public health. Uh, there's primary, secondary, and tertiary, where primary aims to stop the illness from occurring in the first place. Secondary will reduce it if it's occurring, and tertiary will stop it from reoccurring. So they have there's different progressions throughout disease things. So I use diabetes again. So primary would be how to prevent diabetes from occurring in the first place. Most likely diabetes type 2, not diabetes type 1, because it's diabetes type 1 is hereditary. Type 2 is more of a genetic fact. It's more of a genetic factor, but it's more of what you eat and what you do. So type 2 diabetes would be a good example. Primary would be to what you eat and what you do. Secondary would be like how can we combat it as we're in it. And tertiary is how do we now alleviate the situation now that it's already occurred. So the Bayonne Health Clinic is a few blocks away from my house. It's actually very interesting that it began recently, 17 years ago, which is not that far from mental health. It's very few trained professionals. It has like maybe 3 or 4 people, but it actually sees over 350 patients a year, and it does all this on like a 40,000 a year annual budget. It's including rent and everything, which is a really cool thing. Um, so what is their mission? The mission is to be recognized by individuals in need of service and organizations in the market as a premier provider of behavioral health services in Northern New Jersey. So what they're trying just to be known as the mental health clinic that's in Bayonne. If anybody needs anything to go see them, they can ask advice or they can just speak to them if something is going on. The Bayonne Health Clinic tackles many of the 10 points of the public health, including monitoring health, which I will get into, inform, educate, and empower, which you do a good job of, and link to and provide care. So the population served, they serve a variety of people. I live a few blocks, so I see a lot of people who go in. And Bayonne's a pretty small city, a pretty close city. It's only 3 miles of radius, so it's 30,000 people on a 3 mile radius. You could walk up and down the city within 20 minutes. It's so they serve a wide range. They serve people from 13 years all the way up to people in their 80s. I think that I see people all the time in front of it. They interact. They're doing well, and I think that it definitely helps the community. It's a good thing to have. Um, so an example of prevention followed by in public would primarily be to educate people about how to, for example, they do drug addiction. So it would be how to prevent drug addiction. They work with the Bayonne High School, which my brother attends. And I see them, they do a lot of, they go into the schools and they speak to the students about how to avoid getting in contact with opioids. If you take opioids, how can you regulate it? They don't fall into the wrong hands and stuff like that. Secondary, so they do mental health as well. So if people are in their mental health, I think is a big thing, especially because we're in the month of May and it's mental health awareness this month actually. So early stages of mental health are best combated when when they're treated earlier. People usually don't go find treatment right away, but it's best to go and find treatment, if you're feeling something's wrong, it's best to go find treatment with them, and they do a very good job of it. Mental health clinic helps those with mental health to live and treat their condition, avoid recurrence. So again, tertiary, we said is it's already occurred, it's already done. So now it's how to move on and how to work with it beyond what's happening. So the 10 public health services, this is directly from the CDC. There's the 9 around it, and 10th is the research in the middle. So it's monitor health, diagnose, investigate, inform, educate, empower, mobilize community partnerships, develop policies, enforce laws, link to, provide care, assure competent workforce, and evaluate. So again, it's a vital part of the city of Bayonne. The city of Bayonne is only 3.5 miles. It's a small city. It's not a small city actually. It's a very big population, but it's a small city, um, uh, uh, land wise. They only do on a 45 to $50,000 budget annually, and usually goes to rent. Um, and they provide businesses with the community. They provide services to the community, including monitoring the population's health, diagnosing, preventing, and avoiding additional recurrences. So the first one I want to do is monitoring health. So how do they monitor the health? So they see patients and they see patients to make sure that they're progressing and healing from their illness. They do mental health, they do addiction. I think they do counseling for abuse. Uh, they're very important and they do a good job of monitoring the health. They keep records. They keep them confidential, of course. They don't try to. They do keep them confidential. Um, I think they do a good job of monitoring health, which is a very important essential public health. I believe it's number, if we go back to it, monitoring public health is number one, the assessment actually. So it's the first one. Essential public health, inform, educate, and empower. I mentioned earlier that they do courses with Bayonne, and they also have brochures. If you go in, they have brochures right in front, so you don't even have to go into the building. You can actually see them from the outside, so people might not feel comfortable walking in. But you can get the brochures right outside the window, which I think is great. So some people they don't want to be seen walking in. They do first aid and CPR training. They actually do Narcan training too. With Narcan is given if you're a friend of somebody who overdoses, you can save their life with actually uh without them dying. You can just be trained. It's a pretty cool thing. I actually am Narcan trained. I did it at this facility. It's really interesting. They do it all for free. And they give you this little packet with the Narcan to be given to save the person in case they do overdose. It allows individuals to ability to learn. They also have a website which is cool. You could talk to a representative from the facility. I think they're very low staffed, but they get back to you. When I was asking about how to do this presentation, they got back to me within 24 hours, which is great. Somebody who has mental issues, or somebody who has suffering from abuse, or somebody who has opioid addiction, this is a good way for them to interact without actually going in and feeling like they have to go in. Link to provider care. Bayonne Medical Health Clinic actually works with Trinitas Medical Center, which is also in Hudson County. They have a bunch of hospitals. But if the individual, say, is an opiate addiction and the Bayonne Mental Health Clinic doesn't think that whatever they're doing is working, they can actually reach out to the hospital and work with them, and that's providing link to provider care. Again, that's with the consent of the individual who's getting the treatment. They just reach out randomly. Um, And this is their contact information. If anybody wants to call them, they have a pretty cool website. This is on the right is actually the this is they did renovations in the city. Had like they put money aside, which I thought was great. That they put money aside and they re-renovated the whole place, and they actually put like a little kind of gym in it so people can get training. If people want to release some anger or do something for their mental health, it's a really cool thing. And these are the references I used. I used the book. I used the CDC, which was great. And the CDC actually has something going on for mental health issue. As again, this is the month of May. It is Mental Health Issue Awareness Month. I didn't know there was an association for public health, which is pretty cool. Which is number 4. It's also about mental health, which is a good thing to check out this month. And these are the references. And if anybody has any questions, feel free to just comment on it, and how I can improve on it. There were some spelling errors. I'm going to correct them at the end before I upload this. I will keep the video the same, but I'm going to redo the presentation. Just there are some spelling errors. If anybody's any other questions, just let me know. And if I can improve or what you thought about the presentation, it would mean a lot to me. Thank you for watching, and I hope to work with you all soon. Thank you.